November is also recognized as Stomach Cancer Awareness Month. Officially recognized in the United States in 2010, its goal is to raise awareness of the disease as well as worldwide research. The nonprofit organization No Stomach for Cancer has been actively involved in raising awareness and providing information about the genetic markers for stomach cancer. Stomach cancer is the second leading cause of cancer death worldwide. Almost 1 million people are diagnosed each year, and of these, approximately 700,000 will lose their lives. The signs and symptoms of stomach cancer can include indigestion, heartburn or ulcer-type symptoms, difficulty swallowing, abdominal pain, or vague discomfort in the abdomen, usually above the navel, nausea and vomiting and/or bloating after meals, diarrhea or constipation, loss of appetite, unexplained weight loss, weakness and fatigue, sense of fullness after eating small amounts of food. The specialists at Advanced Gastroenterology and Surgery Associates note that the symptoms of stomach cancer can mimic other conditions, so it's best to get it screened.
Patients will present a whole gamut of symptoms. The job is to first listen, ask more specific detailed questions, review the labs that have been done already by the primary. So you try to put the picture together. Then based on the symptoms, you will then break down. Is it more like upper GI symptoms, lower GI? And then based on that, what further diagnostic testing will need to be done. Usually by the time patients come to the subspecialists, such as gastroenterologists, basic labs have already been done, perhaps radiology, radiographic studies may have already been done, such as a CAT scan. So if those are done, and stool studies, for example, in patients with diarrhea and so forth, if those are done, we go down and we do an upper endoscopy. If they review a colon source, then we do the lower endoscopy. But if those are non-specific, then we do further testing, such as looking for celiac sprue labs or lactose testing. But inevitably, given the GI tract and these symptoms to differentiate them, inevitably the patients will need some type of endoscopic evaluation.
In someone who, for instance, comes in with anemia or there's chronic blood loss or some issue going on and they have an upper endoscopy, they have a lower endoscopy and we can't find the etiology, we can't find the source, then that's where the capsule endoscopy comes into play, because you can actually look, it's the same way as a regular endoscopy. The pictures are as perfect as with the regular endoscopy. However, the only disadvantage with the capsule is that so far they haven't come up with anything to actually treat something that's seen. So that's its only disadvantage, but at least it allows us to traverse areas of unknown in the past. You have a monitor attached to you, and the pictures are downloaded onto that monitor. Once you swallow the pill with the camera, it takes pictures as it goes through and it downloads the pictures onto the monitor, which is attached to the patient's side. And it passes out on its own in the stool.
AGSA offers diagnosis and treatment for numerous gastroenterological conditions. For more information about their services and Lake County office locations, click the Stomach Cancer Facts StoryLink icon at yourhometownhealth.com.